Hey, Assalamu alaikum. Greetings, everyone. So today will be a brief overview about CT protocoling. Could be helpful for people outside of radiology, for GPs when they're ordering an imaging, but it's also going to be especially useful for radiology residents or R1s or people that are going to have on calls in the future. And also for interns and students like me who are having a radiology elective, it's pretty good to know about the protocols in CT, MRI, and a lot of other images, but for now we'll focus on CT protocoling. So I'm with you, Dr. Nawaf, an intern, or in other words, a R0.5. So without further ado, let's start. So obviously a CT protocol is a set of parameters that specify a specific exam and a contrast delivery requirements. So like CT brain with IV contrast. Typically, when a CT is requested, it will be vetted or reviewed by a radiologist to determine that the study is justified and what is the most suitable parameters by which that the CT should be formed. Meaning that if you have a case of pulmonary embolism or suspected pulmonary embolism, you should order something like CT pulmonary angiogram rather than CT abdomen, which would be completely incorrect. And of course, when it comes to protocols in general, they can be divided into two areas. Regarding CT, they're divided into radiological protocol and technical protocol. Regarding radiological protocol, it's the type of CT exam that will best suit the clinical question and the patient's presentation. So, as an example, we have a request for a CT head for a suspected intracranial hemorrhage. So, the answer here would be CT brain with non-contrast to ensure there is no intravenous contrast masquerading as acute blood. So any case of head trauma, bleeding in the head, really anything in the ER with a CNS issue, you would order a CT brain without contrast. And suppose you have another example. If we want to request a CT abdomen to rule out a suspected hepatic hemangioma, here we would order a CT scan with 4 phases. They call it quad phase, or in some cases a triphase, where they specifically mean CT abdomen with arterial phase, portovenous phase, and delayed phase, and even C- phase. We'll talk about those shortly. And why would we order this type of, protocol? Is to inspect the dynamic enhancement patterns, because there are some lesions in the liver that can help differentiate hemangioma from hepatocellular carcinoma or metastasis, for example. So these two examples right here are examples of the radiological protocol. And of course, the technical protocol is something that concerns the technologists and radiologists, where once a protocol has been determined, they will then be discussed how the scan will be performed. But that's mostly for technologists to do. So there is a general approach when it comes to CT protocol. The first thing is, what is the clinical question? Do I want to rule out pulmonary embolism? Do I want to rule out mesenteric ischemia, stroke? Like, what is the clinical question? And what is the scan in question hoping to achieve? And then the next thing is, will the CT require contrast or not? And if so, what route? Is it going to be, intraarterial, IV, oral? There's a lot of things. And which phase will be needed? Do I need portovenous phase, arterial phase? And we'll talk about that shortly. The next question is there relative contradictions to contrast? For example, you'll see that people mention that if a patient has renal insufficiency, you shouldn't give them contrast, which is completely incorrect. Contrast-induced nephropathy is a long subject, but in general, if a patient needs contrast, regardless of the renal function, it should be given. When clinically indicated, it should be given without an issue. Or, for example, an allergy, and so forth. And the final question is, can the scanner achieve this exam? So, for example, in your institution, do they have something like a brain perfusion scan? Maybe you have a case where brain perfusion scan is indicated, but it's not available at your hospital. So these are all questions you can ask yourselves when protocoling for CT. So of course there are some always helpful observations when it comes to radiology technologists. If possible, it's always best to ask the radiology tech to have the patient raise their hands up for certain scans and hold their breath as much as possible to minimize artifacts. As you know, as a general rule in radiology, the radiology technologists are your best friend. In medicine, you have your nurses. In radiology, you have your techs. This is pretty much important observation because there are some CT scans that are done right, But unfortunately, the patient, he keeps his hand on his abdomen if you're doing a CT abdomen, and that can cause artifacts, or you can make the CT not as clear as you'd want it to be. So it's always important to communicate with your techs to prevent artifacts, if possible, yani. So there are different types of CTs, and we'll go through them briefly. You have HRCT, you have CT angio, CT pulmonary, and then you have CT first to fourth generation. The third and the fourth, these are the typical CTs that the people order in the hospital. There's dual energy. There's a lot of CTs for a specific indication. Of course, there's something known as IV contrast timing. It's not enough that you just give iodinated contrast via IV and that's it. No, you need to time it, and that's depending on you and the technologist. You need to time at which specific time point is this image going to be taken, because what's going to be happening when you give a patient contrast via IV is that this contrast will go to the vein. It will go to the vein, it will go to the artery, okay? And how will it go to the artery? To the heart. So through the vein, through the vena cava, to the heart. The heart pumps the contrast into the artery, and then from the artery back to the vein, and eventually go to the kidneys, where it will be excreted. Now you see, this contrast, it will travel throughout the human body, and it is on the job of the radiologist and mainly the technician to take a snapshot, the perfect snapshot at a specific time, where we will visualize the veins, where we will visualize the arteries, enhanced by contrast. So there is something known as a phase, like portovenous phase, arterial phase. What is meant by this term? It means that the exact time at which an image was taken, an image was screenshotted, after IV contrast injection into the peripheral vein. So this is important to know, the timing of the contrast. That's what you'll see in the packs. So again, whenever you give contrast via IV, it will go to the peripheral vein, then through the heart. The heart will pump the contrast through the artery, and then from the artery back to the portal venous, and then to the kidneys for excretion. And then you will see these terms whenever you look up a CT scan. For example, after 15 seconds of injection, there will be something known as an early arterial phase, and there will be pictures. You can pause the video if you want to read them, but in general, we have phases, at which time the contrast will visualize the structures that we want. We want to visualize blood vessels. We want to visualize lesions. We want to visualize the liver, the kidney. We want to see if this contrast, is there a washout? Is there contrast in the ureter and the bladder, and so forth. So you can pause the video, but you should know these phases. They will be important to characterize possible lesions or otherwise. So this is an example. I'm going to look at a couple of examples of what we mean by phases. So for example, if I asked you at which phase is the CT, actually the proper question is, this is a CT scan, is this with or without contrast? And the answer is, this is without contrast. And you can tell this is without contrast because you have here the aorta, okay, the abdominal aorta, you have the kidneys, you have the liver. If you notice, none of them are enhanced by contrast. None of them. They're all soft tissue density. And you have the bone here, which is always, bright. It's a bone. But in general, you can tell by this CT, it is non-contrast enhanced. If we look at the next picture, there's going to be a difference. If you notice, the aorta here is enhanced. So this is definitely a abdominal CT with contrast. But where specifically, where is this picture taken? It's taken at around the 15-second mark or the 30-second mark. So this is known as what? The arterial phase, the early arterial phase. So this is around 15 seconds after injection of contrast. And then if we go to the next question, the next image, you'll notice that the aorta is again enhanced, and you can see that, the kidneys, they're showing partial enhancement. Not complete, but partial enhancement. And you can see some of the other organs as well. So which phase is this? This is late arterial phase. 30 seconds later. And then this is a very good picture from radiology assistant that really explains to you why the phases are important. So let's assume you have a patient you suspect to have hepatocellular carcinoma, obstructive jaundice, encephalopathy, you name it. And he has hepatitis B virus infection. Classic presentation. And you notice on the CT, wallahi, I have 3 different phases. I have a CT here without any contrast. I have an arterial phase here, and I have a portovenous phase. So if you look at here, if you zoom in, you might notice a nodule, over here on the right lobe of the liver. Okay? So you might notice a nodule here, and you might assume, this nodule could be anything. So you do an arterial phase, and you'll notice it's an arterial phase because if you remember the blood supply of the liver, 80% of it comes from the portal vein and 20% of it comes from the hepatic artery. So in the arterial phase, the liver might be slightly enhanced, but not too much. So if you see a specific nodule in the liver, which is way more brighter than the surrounding liver tissue, this lesion is known as a hypervascular lesion, and it is always assumed to be metastasis or HCC until otherwise. It could also be hemangioma, it could also be other vascular lesions, but in general, when you have a lesion in the liver like this, and it's much more brighter than the surrounding liver tissue, that means that this lesion is receiving its blood supply from the hepatic artery and not the portal vein like the liver, which is why it's brighter than the remaining parenchyma. And you should always assume any hypervascular lesion, it could be metastasis, it could be HCC, it could be hemangioma. How to differentiate? Look at the portovenous phase. And you can tell this is the portovenous phase because you see here there's a blood vessel. This blood vessel is the portal vein. So you can see it's much brighter in this picture compared to the one on the left. So in a portovenous phase, you can notice that the liver is also much brighter than the previous image, and you notice that they all have the same density. So overall, this was a case of HCC on a cirrhotic liver. So this is why knowing the phases is important. All right. You can differentiate many different lesions, in the liver, spleen, kidney, a lot of things. And look at this one. Which phase is this? So you can notice that there is enhancement of the kidneys and the aorta, and you can notice that there's complete enhancement of the kidney. So this is known as the nephrographic phase, where the kidney is fully enhanced. That's important to assess the kidney completely if there's a cyst or anything, masses or anything like that. And then we come to the last CT scan. Which phase is this? You can notice here that there's contrast here that's going through the ureter and eventually down to the urinary bladder. So this is known as the renal excretory phase. This renal excretory phase is important to, assess, is this contrast, being excreted? Is the kidney functioning well? Or is there a renal mass, obstruction in the way of the kidney? So the renal excretory phase is also important for a lot of things. So these were all examples of the phases. When you look at PACS and you look at all the different images, no radiologist will determine his diagnosis based on one phase. He'll have multiple phases accordingly. And of course, this is all for IV. What about this one? You can notice here you have the small bowel. The small bowel is composed of contrast and gas. So in some cases, you might give a patient oral contrast. So this is a standard oral contrast. You might do this to visualize, the bowel, if there's any, abnormality going on in the bowel. And typically there's another oral contrast that's given that's way better and way more common, and that is known as the volumen. So volumen is an oral contrast, which is pretty much like water that goes inside the bowel and it attracts the water inside. It's pretty much like osmotic pressure. It's attracting all the water to enter inside the bowel so that the wall of the bowels are enhanced. There is notable enhancement of the bowel, and that is quite important because what if you want to exclude, for example, Crohn's disease? You want to see if there's a stricture, right, in the ileocecal region. You want to see skip lesions. You want to see a lot of things. So if you're suspecting, inflammatory bowel disease, Crohn's disease, ulcerative colitis, you might order oral contrast, volumen. Or you want to rule out bowel perforation, where there's extravasation of the contrast. So this one is more commonly used on CT to better enhance the wall of the bowel, as you can see. It's much better in this picture as to the picture from before. So this is pretty much the examples of all the phases. And of course, now we're going to look at examples of the protocols for the remaining of this presentation. Obviously, the way it works in hospitals, you have a protocol and you order it. Some hospitals, they have you order the protocol via a Google form. Some hospitals, no, they have a PAC system. You can fill up the protocol and you'll send it to the technologist. Regardless of whichever pathway, it's all the same. They also have the same end result, which is you as a radiologist or you as a referring provider, you will request an image. The image will be sent to the radiologist. The radiologist will determine the protocol via WhatsApp or via Google form or whatever, and he will send this protocol to the technician to do it for him. Okay? So obviously any protocol will have an organ And every organ has a protocol that basically summarizes the phases. So typically in the liver, you have for example, a liver protocol. For the kidney, you have a renal mass protocol. For the pancreas, you have a pancreatic protocol. These are summaries, اختصارات, that summarize the phases in one go, like a package. There's bleeding protocol, there's ischemic protocol, and we'll look at examples, inshallah. So obviously, these are all examples here that we'll look at it one by one. So for example, the most common cases is suspected stroke. So if any ER case of a patient you suspect to have stroke, to have acute head trauma, altered mental status, previous episodes of syncope, we're talking cases of, neurological events that are acute. You always order here CT brain without IV contrast or plain. And why is that? Because contrast can obscure acute blood, which is hyperdense. So you always order CT brain with IV contrast as your initial imaging in any case of suspected stroke or head trauma or altered mental status secondary to a suspected neurological cause in the ER. Always and forever. And of course, if you have a known case of subarachnoid hemorrhage, for example, on previous CT, you might instead order CT angiogram of the head with IV contrast to assess the subarachnoid hemorrhage. Is it still present or not? Now, what about other cases? For example, you have an acute spinal trauma. What will you order? So the thing that you'll order here is very simple. CT spine without IV contrast. Why? You want to assess for fractures in the bone. Where is it exactly? In the lumbar, in the cervical, thoracolumbar? Where exactly? So typically in any spinal case, which is secondary to trauma, or let's say osteoporosis or whatever, you always order CT spine without IV contrast. However, if a patient comes to you with lower back pain, for example, and it's suspected to be sciatica or is in a non-trauma setting, in this case, CT spine will never ever solve the issue. CT spine will assess the bone, but it will never assess the soft tissue like the discs or if you suspect discitis. So this is quite important to know because there are people from the rehab, from orthopedic, they assume that any back pain you must do CT spine, which is not true. So any case of trauma, CT spine without IV contrast. Now, of course, if you suspect in a trauma case there is vascular injury, then you may also order CT angiogram head and neck with IV contrast. For example, if a patient had a cervical trauma injury and there's a vascular injury suspected like bleeding, like neck tenderness, then there can be clinical indication to order CT angiogram head and neck with IV contrast to assess the blood vessels. Now, what about other traumas? What about hand trauma, acute hand injury, wrist trauma, hip, elbow? What about all of these things? In general, the referring provider should do a plain X-ray. Whether it's the hand or the wrist, you should do an X-ray. And then if the X-ray, if it's not clear, if it's inconclusive, then you may order CT hand or CT wrist without IV contrast if needed. And in general, if you suspect tendon or ligament injury, you may order MRI without IV contrast because CT is good for bone, but it's not good for the disc, it's not good for ligament or tendon assessment. So it depends on the case, but in general, any trauma to these regions, MSK stuff, plain X-ray, and if it's inconclusive, you may go with CT without IV contrast. And again, we talked about lower back pain and really what's the indication really. And of course, what about aortic dissection? If we suspect aortic dissection, then you must immediately go towards CT angiogram of the chest to basically classify the dissection. Is it, group A or the group B? Plus or without chest without IV contrast. Typically, chest without IV contrast may be done to look for intramural hematoma in aortic dissection. So aortic dissection, it's very specific with this very specific protocol. Now, what about pulmonary embolism? This one is very easy. You order CT pulmonary angiography, and they have their own protocol. They call it PE protocol. He has CT chest with IV contrast. And why is that? Why this protocol? To detect the filling defect, the emboli, because an embolus in pulmonary artery will cause a filling defect. Typically, pulmonary arteries are white with contrast, but if you see a dark filling defect, that's an embolus. Now, what about if they suspect lung malignancy, lung cancer? Or what if they suspect complicated pneumonia? What do you order? Chest CT with IV contrast. Typically, this is what you order if you suspect like malignancy. Why? You want to look for nodules, you want to look for the pleura, is it thickened, like what's going on here, and so on. Is there atelectasis, many things. Now, what about interstitial lung disease or bronchiectasis, suspicion? You order HRCT, which is high resolution CT. Why? Because it will completely assess the lung parenchyma in 4K resolution. Basically, what HRCT is, it is a CT scan, but it will show the lung window in 4K resolution, meaning it will magnify the lung window. It will show you exactly the lung parenchyma. Is there fibrosis or what is going on here? And it's important to know the difference. HRCT is not the same as CT pulmonary angiography. They are not the same. HRCT is without contrast. It is there to assess the lung parenchyma. While CT pulmonary angiography for PE, this is there to visualize the blood vessels with IV contrast. They are two completely separate entities. And that's important to clarify with, people outside of radiology because they get confused between the two. But anyway, in HRCT, if you suspect fibrosis, go ahead. Why not? Now, what about the liver? Again, we gave you an example of the liver with these three phases. So again, whenever you suspect metastasis or hepatocellular carcinoma or really focal liver lesions in general, you order a CT abdomen with IV contrast, arterial phase, the most important portovenous phase, and the delayed phase, or sometimes they call it triphasic CT. They refer to these three phases. So as we look at previous, examples from before, if you suspect on the liver that there's a hypervascular lesion with rapid washout of the contrast, meaning on delayed phase, then it's likely HCC. But in general, you will never confirm HCC through CT. There's suspicion of HCC or cirrhotic liver, but in order to confirm it, you need MRE or fibroscan for confirmation. So again, the liver is very simple. You need a triphasic CT in general. Now, what about adrenal glands? If you want to evaluate the adrenal glands, it's very simple. CT abdomen and pelvis with IV contrast. Sometimes they order two CTs, one without contrast and the other with contrast on portovenous phase to compare between the two. Now, what about kidney stone? There's something known as CT-KUB, and this is basically a CT scan that focuses on the kidney and the ureter and the urine bladder, but without contrast. And this is quite important because you don't want to give the patient contrast where it can mask a presence of a radiodense stone. So if there's a kidney stone, you don't want to give it contrast because it may mask it. So any suspicion of a ureteric stone, flank pain, order CT-KUB without contrast. Now, what about renal mass protocol? What if you suspect the patient may have, renal cell carcinoma or hematuria? In that case, you order CT abdomen with IV contrast. And again, you may order CT abdomen without contrast and then one with IV contrast. And you mainly want to focus on those two phases, of course, the nephrographic phase and the excretory phase. And why? To characterize the mass. If there's a mass, you want to characterize it. Now, what about the pancreas? In pancreas, they have their own protocol. They call it the pancreatic protocol or pancreatic mass protocol. In any case, if you want to visualize the pancreas, you order a CT abdomen with IV contrast. In general, you want to focus maybe one without contrast, but really you want to do with IV contrast. You want to focus on two phases. The portovenous phase is the most important one. But you also can do pancreatic arterial phase. In general, why is this important? Because the pancreas normally enhances on CT in late arterial/pancreatic phase. This is important because if a patient has pancreatitis, the area of the pancreas that is not enhanced, that is abnormal. If any pancreas is not enhanced on CT with contrast, that can be secondary to necrosis. That can be secondary to inflammatory fluid. So it's important to know that if you want to assess the pancreas properly, you can order one without contrast for comparison, but at the end of the day, you have to do with contrast, especially with arterial plus portovenous phase to assess it properly. Now, what about polytrauma? What if we have a patient with road traffic vehicle accident? He has multiple fractures and suspicion of internal bleeding. Here you order what is known as pan-CT. Pan-CT is basically CT that basically does CT for the head, chest, abdomen, neck, everything. typically with IV contrast portovenous phase, and they have their own protocol known as the trauma protocol. So any case of polytrauma, and I mean really polytrauma, multiple trauma injuries, you do pan-CT with IV contrast, specifically portovenous phase, or the trauma protocol. And what if you suspect abdominal wall hernia? In that case, you order CT abdomen and pelvis with IV contrast, specifically portovenous phase, to assess the hernia. All right, IV and not oral contrast. Now, what about appendicitis? What about diverticulitis, suspected bowel obstruction, pancreatitis, blunt trauma? All of these is abdomen and pelvis with IV contrast portovenous phase. This is definitely what you order for all of these conditions, and they are by far the most common conditions on ER, on oncolat, especially for radiology residents. And what I mean by blunt trauma is blunt trauma to the spleen, for example, specific region, for example. So in any case, all of these cases have the same protocol: abdomen and pelvis CT with IV contrast, portovenous phase. Now, what about mesenteric ischemia? With mesenteric ischemia, you have to immediately order CT angiogram. You have to, of the abdomen, to basically exclude mesenteric ischemia. And of course, they have their own protocol known as the ischemic protocol. So for a case of mesenteric ischemia, CT angiogram of the abdomen. So this is pretty much the end of the presentation. These are all examples of the protocols for all different cases. In general, any protocol, you need to discuss it with the physician. And in any case, if you don't know which protocol to order, you can always ask your seniors. You can always ask your consultants. It's fine. Because the only one who will be in trouble is not the referring provider. It will not make a difference for him. But it will make a difference for the radiologist. You want to make sure that the image that you order is an image that will solve all the clinical questions that you have in your head. So I will end this presentation by mentioning a very good resource to revise the protocols, ASR appropriateness criteria. This is a website and that is basically interactive. And what this website is that this allows you to search any protocols that you want or any cases that you want that indicates a specific protocol. So this criteria is excellent if you want to revise the protocol for a specific condition. Go look it up, and it's definitely worth it. It's by far the best one so far. So that's the end of the presentation, and thank you very much.